So this is a good question, and it can be pretty complicated, but you can get insurance to cover implant removal sometimes. So the first thing is, if you are a patient with breast implants because of cancer reconstruction or just reconstruction in general, it's a lot easier to get insurance to cover implant removal. So if you have those past diagnoses, this process can be less challenging. Now, if you have cosmetically placed implants, some insurers don't allow any surgery for any reason if you've had them placed for cosmetic reasons. So unfortunately, that's just, it kind of is what it is. But a lot of insurers do cover removals in certain situations, in particular, ruptured silicone, not saline, unfortunately, and severe capsular contracture. So if you have those two things, they will often cover a portion of your surgery, or whatever they cover, for the implant removal as well as the capsule removal. They do also sometimes cover repair of the muscle. So if your implant's under the muscle and it's repaired at the time of surgery, sometimes they'll cover that. So infections around implants can certainly lead to coverage of implant removal, typically in the acute situation. So if you're sick in the hospital, you're septic, you show up in the ER with an infected implant, usually, in my experience, insurance will kick in and cover the removal, and it's done emergently, of course, at that point. Now, infection is a little bit of a different scenario. If you come in acutely with an infection, so if you're in the emergency room and I get called and you have an infection, or if you're in the ICU septic with an implant infection, then yes, that is an emergent go to the operating room trip, and insurance typically would cover the removal in that situation. Now, sometimes you do have patients that have recurrent infections that don't lead to implant loss. And those patients, once they've recovered from the infection, insurance usually won't, in my experience, but it's always worth a try. Sometimes though, if you do have an infection near your implant and it resolves, it can lead to a biofilm and contracture, and then that can lead to coverage. The one thing that I always find helpful in situations where you may not be the classic indications for insurance coverage is to get as many doctors as possible to support your cause. So if you've had prior problems with your implants but you don't have a current problem, it's often best to get the doctors that took care of you prior and your primary doctor to write letters in support of whatever you're pursuing. So that's kind of the basics on how to get insurance coverage. It can be challenging. Not all practices work with insurance, so it's important that you, if you have a more complicated situation, you work with a practice that works with insurance more commonly, because they're really hard to work with. And unless you know what you're doing, you're not going to be successful.